Welcome, I'm Christine Dashfield from Civica Health and Care Division, and we have a mixture of people attending today. So we've got some current users of our staff rostering system, and we also have some new prospects on the call as well. So anybody that wants to have a full presentation following this short overview, then please contact our health and care team at civica.co.uk, and any existing clients, if you would wish to contact your account manager. So I think I might have Callum on the call. Andy apologises, he's not here for this particular call, but if you want to contact him later on, Callum, and he will arrange to do a full demonstration for you as well. So what we're going to do is to start off with a very quick overview of the Civica rostering system. So the Civica rostering will start with an employee's record, and the employee record can be imported from the Civica HR onboarding system or from your own HR system, or you can manually put your employees into the Civica rostering system. Once they're in there, they'll be allocated to a team. So a team might well be a care home. It could be any other type of business where you need to roster staff. So it could be a hospital, for example, it could be a cleaning company, it could be retail. We'll go through what we call roster, demand, rota, and allocation. So you can set up how many hours you might require of your different grades of staff, how many different shift patterns you need, and which staff are best suited to do the shifts that meet the actual demand. So we have something called skill matching as well. If you require qualified nurses, then we will need to check, have you got the right qualified nurse to do the shifts that's required? Do you need a first aider? Do you need somebody with more complex skills to provide a shift? Live service delivery will all be about, in your team, what happens today. Has everybody clocked in? So have they clocked in via the mobile app? Have they clocked in via a time and attendance kiosk? So it's a great dashboard to have a look at and see exactly what's happening in your team, or if you have access to other teams, you can also look at other teams as well. Absences, so things like training, holidays, all of that will be monitored within the rostering system, and the shifts, absences will all be fed through for payroll. So we can have a look at how we can confirm the shifts that have been worked or not worked or outside of the planned shift, and then generate the confirmation of pay ready to go back into perhaps Civica payroll or any of your other payrolls as well that you use. So we'll have new export routines that you can pre-look at your payroll before you send it to the actual payroll system. So you might want to export it to Excel, check how much you're paying your staff, look at all of your absences. The Civica roster also provides inbuilt dashboards, so you at a glance will be able to see how many staff have clocked in. Have you got any staff who are absent? Has anybody not clocked in within time? And lots of different operational reports as well. So I'm just going to stop the PowerPoint for a moment, and then I'm going to go into the main system. So as I just stop, it will then just change, and we'll be able to have a look at the Civica rostering system. So your view has now changed. Up in the top right-hand corner, you've got my name. I have logged in with my username and password. So that will give me access to my full menu along the left-hand side. So I might have access to set up who can use the system and what permissions they might have. Can they actually add new employees? Can they look at payroll information? So for example, can they export the payroll out to an Excel file, or do they have the options to export it into the payroll system? Are they allowed to send out shift offers because you need some shifts filled at certain times, whether that's today, tomorrow, in a few weeks' time? So each of the users that can log into the system might be able to add, edit, delete, and have access to the different menu options within here. Now, each employee, as they log in, might also have access to a team. So I'm going to first of all log into my team, and it will open up and it will show you that I have a care team. I'll just collapse my menu bar for a moment. So for the purpose of today's webinar, I'm going to concentrate on a care team. So I have a care team of residential social care workers. I've got administrators who might be bank staff. I also have activities coordinators within here. So I have a large team of staff that can work within this particular care team. So a team is like a care home. So if I've got lots of different care homes, then I will be able to have lots of different teams, and I will have the staff that work within those teams. So I might have a group of care workers, and I might call them care workers, healthcare assistants, or social care workers. So you can see on here, I have a huge list of my actual staff. Some of them are on contracted hours. The numbers here indicate how much experience they've got, and over on the right hand side, if I wanted to look at more information against that employee, I can drill in and have a look at their diary to see what they're due to work, and also look at their own profile. Now, each individual employee will be able to access their own diary by logging into a web portal with their username and password, and they'll be able to have a look at their own information. But as I have access to multiple teams, I might just look at the care team, but I might also have access to, say, a hospital team. So in my hospital team, I might also have care workers, but they're classified as perhaps band 3, band 5, band 6, band 7 support or healthcare workers. So different teams of staff can be entered into the system depending on your business and your requirements for rostering. So care homes have different care home names. It may be that I also have a retail organisation. I need to actually roster staff, whether they're a carpenter, whether they're the catering manager, housekeepers, they work in the clothes department, the beauty department, etc. You have your team of people, they all need to work shifts and they all want to get paid. So each of the teams can be set up based on what your requirements may be. And the last team that I also have on here is a cleaning team. So I've got people who do window cleaning, commercial cleaning, and so on. And I've got access to lots of different teams. But I'm going to go back to my main team again, and I'm going to have a look at my team within the care sector. So when I look at my particular team, not only can I have a look at the staff that work in that team, but I can also monitor absences. So I can have a quick look and see, based on December, I've got 2 people who have requested holidays or absences. I can filter this by looking at just sickness or holidays. I can also filter this by what we call job roles. So are they care managers? Are they team leaders? So you will have your own drop-down list of different job roles. If I scroll down just a little bit further, you'll be able to see that we've color-coded everything within the system. So it's easy to see, is anybody off sick? Is anybody on holiday? But when people are requesting things like absences, they can actually request the absence, but somebody else may need to approve it. So for example, I have gone in and I've gone in either to my actual web portal, or I may have asked a manager to say, I would ideally like some holiday or some absence at a particular time. So on this particular screen, I can see how many staff I have within my team each day, how many people have absence. So if I've got lots of people wanting Christmas Eve off, then I might say, sorry, I can't give everybody that day off. Luckily, nobody seems to want to have that day off at the moment. But if we have a look at my record, I've got an R against here because I've actually said I want to go off to have a healthcare checkup. I've requested this for tomorrow. However, on this particular case, it's been requested, but the manager has not yet approved it. So that's why I've got the number 1 over here. But if I go back and have a look at last Friday, I did have a holiday and it was approved, and that information will be fed to the payroll for confirmation of pay. So if I am going to get paid, then I will get paid for the holiday, or it might be unpaid holiday. So this particular screen allows you to have a look at all of your members of staff, look at all of the holidays. You'll be able to go back and forth, and also it will identify when there is a bank holiday or public holiday. Now, some staff might automatically be unassigned from any work on public holidays, or it could be that they will work on those particular days. So that's all part of their actual profile that's set up. So if we just go back to my team again, we can see on here I've got Zoe, who says she's a kitchen assistant on 0 hours. Now, if I just drill into her particular profile, I will have a look at the information, and again, that can come from your HR system. This will show me the details of Zoe, and I have access to update this information, but if Zoe logged in, she would only be able to view. She can see what job contract she's got. So just now we looked at it and it says she was a kitchen assistant. She is a kitchen assistant on 0 hours. However, she also has another contract as a care worker. So she can have 2, 3, 4 different job descriptions on different contracts. They may all be paid under the same payroll, whether that particular payroll is a payroll group that is weekly, 4-weekly, calendar monthly. When it comes to the pay element as well, you can define the dates of when you pay, so whether you're paying in advance or in arrears. And you'll also be able to define what we call time bands. If somebody is working a shift and they work over that bank holiday, do they get paid the whole shift at one rate, or at midnight does it go into a different rate, or at 8 o'clock at night do they get an enhanced rate because they're working into or out of a bank holiday? So lots of rules around pay for each contract that an employee works. Now, Zoe works as a residential care worker on a 43-hour contract. So if I just drill into her actual record, what it will do, and you might have a little time delay on yours, but when it comes in, it will come up within here and show me the details. Sorry, it's just refreshed. It will come back up again in a moment. It will come back up with the details to show me she is contracted to work 43 hours on a weekly contract. She is part of payroll. So you might also have people who are agency people. And she is working on a 12-hour, £12 per hour contract. She also has a maximum number of hours that she might work. So these 2 hours are very key to when you are looking for staff to work. You want to make sure that people have worked their contracted. However, they might work up to a number of hours. They might also have a target number of hours. So people who are on 0 hours contract might say, I'd like to do 40 hours this week, 30 the next. So you can also set it up to say, okay, over a number of weeks, they will have met their contracted, but it might vary on different weeks. This person also has 24 months experience in this job role, and they also have some annual leave allocation to them. They are allocated to a pay group, and this person is paid on monthly pay, and they will also have pay arrangements behind as well to say what their pay is. And again, I go back to the pay setup. You can set up things like pay scales. You might have different people on different rates. They might have a different rate for days, nights, weekends, training, on call. All of that can be defined within the system, but that information is then key for when we export the details back into payroll. So you can see we've got the payroll export option there as well. If I just go back to this person's main profile, Zoe is allocated to some different teams. So in this particular case, she is allocated to the care team, i.e. a care home, like called Apple Lodge, as a residential care worker, but as a kitchen assistant, she is working in this particular care home and another care home. So she could work a contract, perhaps as bank staff or as a kitchen assistant over multiple different sites within here. If we just look at her diary, so again, an employee can log into the portal and they can have a look and say, okay, I want to have a look at my actual diary and I want to be able to see what I'm doing. So today it's highlighted Thursday the 14th. If we have a look at this particular shift down here, she is working as a residential care worker in a care home, and the status says in progress. So her shift started at 7 and should finish at 12. It's currently in progress. Yesterday she worked in the kitchen, and if we go back and have a look at other days, perhaps to Monday, you can see that the status of that particular shift says completed. So she can easily see that shift started and finished. If we have a look at Friday, she is actually on a paid holiday. And if we move across, we would also be able to have a look at what happens on different weeks as well. So as far as Zoe is concerned, she can dial in and have a look at her own particular diary. She can also look at that information via the mobile app, and we'll come on to the mobile app in just a moment. So just going back to her particular profile, other information might be contact information. So you want to contact her by email or mobile phone. And we also have skills and qualifications. So if you have registered nurses and you're looking for somebody to fulfill a nursing shift, they would need to make sure they've got their NMC. They may also need to be a registered nurse or a registered mental health nurse. It could be if you're in more complex care or dealing with children, you need different skills. If you're working in something like commercial cleaning, you might need to have certain skills to deal with, say, window cleaning, for example. So you will be able to define the different skills, attach them to the employee record, but also be notified if any of those skills are due for renewal. Now, there will be alerts within the system to notify you on that, or it could be that you want to produce a specific report, and under the reports section, there will be reports that allow you to say, okay, I want to actually have a look at everybody's skills that are due to be renewed. You'll notice, excuse me, we have options to export to PDF and Excel. These are my favorite reports, so I've locked in my favorite reports within here, but there are some other reports I have access to. So I might want to look at things like holidays. I might want to have a look at my own calendar. I may also have access to have a look at things like rostered hours, days and nights hours as well. So lots of different types of reports within here. Each of the reports, as you go into them, will give you different types of filters that you can have a look at, and you'll be able to export to PDF and Excel. However, you can have a look at what would the report look like before you actually generate it. So if you were looking at specific skills, saying somebody has dementia care skill, you can have a look at it and see when it's due to actually lapse if they've got specific license numbers as well. So there's a lot of information as far as reports are concerned. Now, if I just go back to the home menu and I go back into my search, what I'm going to do is just call back up and find Zoe just one more time and do a search this way on, oops, I went into the wrong Zoe, sorry. I just go back to my search, go back in and search. I've got two Zoes spelt slightly differently. I'm going to go into Zoe here. The last option I didn't show you was absence. An employee can have access to say they would like to request some absence. You'll be able to see clearly on the dashboard here how many holidays have been booked and how many are outstanding. So she's got 9 hours that she can still book. As far as her holiday is concerned, she might have an entitlement only as a care worker, but not as a kitchen person. The holiday entitlement could be accrued. It could also be days or hours. If we just look down a little bit further, you'll notice that you can filter by any type of absence category. So when somebody requests absence, it could be that they're requesting some time off because they're doing jury service. It could be for any type of reason that you might want to set up. It may be long-term sickness, maternity, paternity leave. In this particular case, Zoe has requested some holiday in January next year. She's requested, but it has not been approved because she does not have the authority to approve it. So a manager would need to come in and they would then be able to say, I'm going to approve this. If I look down a little bit further, I can see any other details of holidays or any other type of absence as well. So through the reporting, you'll be able to see what's entitlement is, what's outstanding, and you can also do things like prediction reports and burn down reports on holidays and absences as well. So that's an employee profile. So I know that Zoe is a residential care worker. She works in a specific team, which is my care home team. So now I want to have a look at what she is actually working, because we've looked at her diary. We know what she could be working today. So we're going to go back now to the main menu, and we're going to look at live service delivery. What is happening in my team today? So I might want to just have a look at who's working in the kitchen, or I might want to have a look at who's working in the activities room and so on. So as I look at today, Thursday the 14th, I can see that I currently have in my team 6 shifts that are in progress, 1 that's unrostered, 4 with alerts and 1 absent. Now 4 with alerts could well be that somebody has not started their shift, not finished their shift, or maybe they were outside of the shift parameters for starting and stopping. In each team, you can actually see the different job roles that might be working in your team. You can see where they are working within that particular team. So in a care home, they might have upstairs and downstairs. They might have a kitchen. They might have other units that people work in. And I've also got people working in activities room as well. I then have different what we call services. So I would have an administrator who is part of the admin reception job role team, but she's working perhaps in the main care home, or you could say she's working in the office. The activities service is working in the activities room, and that is an activities coordinator. So this is what's happening together in my particular service. If I swapped that and I had a look at a hospital, then the hospital again will show me this inbuilt dashboard, and it will then define the different job roles that are within my hospital team. I can also see who the main contacts are within the team. So I might have 1 or 2 contacts, but this time I've got 6 shifts in progress, 1 unrostered, 2 with alerts, nobody's absent, but they are working in different wards. I've got care workers, team managers, registered nurses, and I've got services based on the band of staff that are required. So if I just scroll down a little bit further, what we'll be able to see is that I've got Abby Apple. It's a bit of a mouthful, but I've got Abby here who actually is working a shift. So if I just scroll down a little bit further, I can see that she's in the hospital team, working in the clinical ward. I can also see that on her record that she was due to work at 9 o'clock. She actually started her shift at 9 o'clock. So this is a very visual screen to actually see, have you got any shifts in progress? So orange means they're in progress. If anything is in the purple, then it's been published to the employee. They're aware of it, but they haven't yet started. So Linda, for example, hasn't yet started her 1 o'clock shift. If we go back and we're going to swap back to the care home team again, so it will just have a little delay on your screen when it pops up. But if we go back and have a look at the care home team, we've got different job roles, and I can filter those. So I might just want to look at who's doing care work, but I'm going to leave it open for a moment, and I'm just going to scroll down so that you can actually see who's in my team. So I've got Harry here who's in my team, and he actually worked a night shift. So what this allows me to do is to hover over that particular shift. I can also drill into the shift, but I can see that he worked a night shift from 10 till 7:30. He actually clocked out 4 minutes early. There is no triangle to warn me about that, because that's within the parameters you've set. You can set up parameters to say that somebody might be able to clock in early or late via, say, 3 minutes or 4 minutes. It might not have any effect on their pay. Or it could be they clock in half an hour either side of their shift, and you might add extra hours on, or you might deduct time on. But that will all be part of your pay processing rule for each of your employees or your group of employees. So Harry has completed his shift. If we have a look at myself, you can see on here that I actually have a shift that was 7 o'clock in this morning. I clocked in at 6:55 and I'm due to clock out at 12 o'clock. If we just go back up to Harry, what we can also see on Harry's record is that he has holiday, which was approved. So we can see clearly on this screen, this is why we've got the marker, absence approved. And if we have a look at my record, we can also see over on the right-hand side, I am working in another team. So if for some reason I needed to come back into this team, then it could be that you need to contact the other team, or you might want to move me from one team to another. If we look down a little bit further and look at Zoe, you can then see that on Zoe's record there is a triangle, i.e. an alert. So the alert is that she actually clocked in at 7:28, so she should have started at 7 o'clock. Now within here, you can go in and end people's shifts if you have access. So perhaps somebody didn't actually end their shift when they should have done, and you can end it for them. Or you can go into the actual shift and have a look at the more details about that particular shift as well, if you've got access to do it. So I haven't got access on this screen, so it's not allowing me to actually clock in. So you will have different access levels to do different things within here. Now, if we just go back up a little bit further and have a look at the shift over here, I've got a blue shift over here, which basically is a night shift, and this is unassigned. If I need somebody to do this shift, I can drill into this particular shift and say, okay, who can do it? I may well know who's going to do that shift, and I can put their name in against it. But if we look at the details, we've got a shift from 10 till 7:30 tomorrow morning. We need a care worker who's providing a service as residential care worker. So you set up your own service names. It's in the main location, could be upstairs, downstairs, or a ward. And we have what we call a target cost. You can define what the cost might be for a care worker to work a certain number of, to work a shift. Now, it could be that I've got staff on different rates, but this is my target. I don't want to go over or under. When we come to look for people, it is going to find the exact match based on their job role. It will also check that they are available. They're not already working somewhere else. It will look at things like their contracted hours. How close are they to their contracted hours? You can also incorporate cost, so how much it would cost, target hours, and experience. I'll do a search first of all, just so that you can see how this works. And if I just scroll down, it should have come up with 12 people. It only came up with 7 because only 7 do the exact match. So it's had a look on here, and it's basically shown me the different staff that could do this particular visit or this particular shift. So I can see I've got Emma here. She's a care worker. She's got 73 months experience. She's currently available. She would also match the skills if I had skills that were specific requirements within here. We'll come back to the skills in a moment. But we can see on here in the middle section here, she's contracted to do 37.5. She's only done 16.5 so far this week. Her maximum is 43, and her target is her contracted. However, some people might have lower or higher contract hours, especially 0-hour people. And we can see it will cost us £106 for this person. But if we chose Amber, then Amber is a rate of 111. So if that is something that's key to you, cost, then you would look at the cost. If I just change this and go have a look at all suitable people, then I may find that I've now got more people that have popped up, because I've also got the registered manager that's popped up. I don't want them initially, I want care workers, but it could be that this person has to cover if you don't have enough staff. So currently Sophie has no hours at all this week. Unfortunately, she's going to cost us a lot of money. She's done 701 hours as experience. And if I just drilled into her skills, now I'm not looking for any essential skills for this particular job. It would be nice if she was a first aider, but she's not in this particular case, but she does have lots of other skills. So you can use this to do your staff allocation within here so that you then clear any unassigned visits. So a great view on a daily basis to have a look and see what's actually happening. Now, if we have a look at Gareth, we can see on Gareth here that Gareth should have started an actual shift, and he hasn't actually started his shift. However, I saw him running in this morning with his piano, and he's ready to actually do his shift. So I know he started. So as a manager or a planner who has access to this, I can come in and manually start his shift. If he hadn't turned up and somebody else had, I could reassign that shift to somebody else. If for some reason we had cancelled today's activities, you could cancel the shift. If the shift changed, then again, you could modify the shift to say it was a different time. If Gareth was unfortunately sick or absent, we could also put in details of his absence, reassign the visit to somebody else, or cancel. In this particular case, I'm going to go in and say, I did see him, he's arrived, but he didn't have time to clock in via the kiosk. So we're going to manually clock in him using his planned time. It is mandatory that I have to put in a reason, and you would have your own drop-down list, and you can see it's being recorded by myself. Now, if he only just arrived, he would be 2 hours, 36 minutes late. It would force me, and again, you will have your own lookup list to say, well, why is he actually late as well? So you can record that, and as I've said before, that will go back to pay. I'm going to say he did come in at 9 o'clock. I'm going to monitor this information, and I'm going to actually say he just forgot to log in. At the top, it says this shift is currently published, but as I click on save, it will now change that particular shift, and it will change it to say that it's in progress. So when somebody clocks in, it immediately updates the screen. And if we go down and have a look at this shift now, you can see that that particular shift is in progress. But if an employee was clocking in and they were clocking in via kiosk, then they will have access to clock in and out via the kiosk. So I'm just going to bring in my kiosk into the view. So you should now be able to see the kiosk. So each person will have access via the web browser to the kiosk. You can customize this. So it might say that this is your hospital or your ward or your place of business. As an employee comes into work, they can then click on the screen to touch to log in. And it will work similar to a gym or a doctor's surgery, whereby you will pick up the first letter of your surname, the month of your birth, the date of your birth, and then you will key in your individual PIN number. When we log in with our individual PIN number, what it will then do is check and authenticate that I am the person logging in. Now I'm logging in and I currently already had a shift that was in progress. So if I click on that shift, you can see that I've got a shift here that I'm not due to finish until 12 o'clock. If I look at the details, you can see there's my shift that I clocked in at 6:55 this morning on an early shift in this particular care home or team environment as a residential support worker. If I click on close and I just go back, I could then say, okay, well, I don't want to end my particular shift at the moment. I just want to go back to my main sort of details. I want to close the screen, or I can go back to my home menu. If I was going to end that shift, which I will do for a moment, if I click on end the shift, it will come up and say your shift is ending early. If I was in my parameters, it would have just stopped and finished my shift. So I'm going to say, well, I wasn't feeling great, so I'm going to click on the sickness option, confirm. My shift will now be ended. And that will immediately update the actual roster to say that that shift is ended, and it will now change to an actual pink color. If I clocked in again and I put in all my details again along with my actual PIN number, and you might have different reasons for starting and stopping a shift. When I clock in now, it will come up with my shift that I'm due to start at 8 o'clock tonight, and it says, well, you'll be starting very early if you're going to start that shift. If I go into the details, there's my shift, 8 p.m. tonight till 8 a.m. in the morning. It will be a night shift. I don't want to start that shift, so I'm just going to close and come out of that option. So if we go back to the main live service delivery, I clocked in, and I clocked in with my actual kiosk. And from the kiosk, what it has done is now updated the main roster. And if we go down, my shift has now been completed. Now, what I could have done was I could have actually clocked in via my mobile app. So what I'm going to do is just show you the mobile app. And I'm just going to show it through a PowerPoint for the moment, rather than clicking into the live mobile app. But if you want another demonstration, please, as I said, contact your account manager or go to the address I'll put back up at the end of the session, and we'll go through this live. But I've got my mobile app here, so I would be able to log into the mobile app with my username and password. And what that would do is then show me the details that I had actually clocked in. So earlier on, I just took a snap of the fact that I had a shift this morning from 7 o'clock until 12 o'clock. And because it came up saying clock out now, I would have clocked out now. But I've already done that through the kiosk. So you can clock in or out via the kiosk, or through the mobile app, or through the live service delivery, providing you've got the access level to do that. But if I look at the mobile app on here, you can see my shift was 7 till 12. And when I took the screenshot this morning, it said I would have been clocking out at 8:39. Therefore, I would have had to put in a reason why I was finishing early. I didn't finish that shift this morning, just so I could show you finishing on the kiosk today. If I go back to the mobile app and I want to look at my diary, I have options on here to have a look at what's happening on my diary, the same as we looked at through the main screen. I can look at things like shift offers. I can also set up my availability of target hours. If I have a look at my diary, what my diary would do is color code exactly the same as the main product. Orange, anything in progress. Anything in purple is published. So I can see, go back, have a look at next month and see what I'm working. If I drill into any of those particular shifts, I will easily be able to actually see the details. So my shift was in progress. Because I started it on the mobile app at 6:55 this morning, it picked up my actual address. And it says I was doing an early shift in a care home. It will also give you notifications on the mobile app as well. So if you want to have a look and see, sorry, I've got a tickly cough today. If you've got the mobile app, you can also see if you've got any shift amendments, you've got any new shifts published to you. You'll also be able to see if any shifts have been offered. So within the main product, if we're looking for staff, we might not be able to find people. So we can actually say, well, okay, what we want to do is not allocate now. We want to publish it to everybody that's suitable, and they can then apply for the shift. So there are two particular shifts here on the 27th, an early shift and a night shift, and I could apply for one or even both of those shifts. When I do apply for the shift, it will then move across to the applied on my mobile app. And if it's approved, I will get a notification, and I will also see that it moves from applied to approved. Within the main product, there is a shift offer screen that you will be able to have a look and see your actual shifts that you've sent out offers to, and it will provide you with a whole list of everybody that has actually sent in and said, I'd like to do that shift. So you can see at 9:41, I actually applied for that particular shift. And if the manager approves that, I will get that shift. It will update onto the main roster. If it's rejected, somebody else might get it. And shift offers might work on first come, first serve, or you might want to actually select who does the shift. So what we're now going to do is we are going to go back into the main screen, and this time we are going to have a look at what happens as far as viewing information on a weekly basis. So if we have a look back at the system, we can go in and say, okay, well, yes, we've been looking at things that are happening today. We can also have a look and see what's happening tomorrow. But we want to have a look at everything for our particular team. So we might want to look at everything that's been rostered. So you can identify this might be a late shift. This might be say a early shift. So you can put codes against each of these particular shifts. So again, it's color coded. If I scroll down a little bit further, you can actually see that I've got an assistant manager working here. I've got an administrator. I might have a residential care worker, but you might just say they are early shifts or late shifts or night shifts. It's entirely up to you. You can also identify if you've got anybody on 0 hours contract. Luckily, nobody on agency. From here, you'll be able to go in and we will have the options to do things like drag and drop within here. And you can also reassign your visits as well. If I just want to have a look at, say, Christmas week, and I go into Christmas week, I can see that my shifts here are all in purple. And that's because they have been published to the staff, but of course they can't yet start those shifts. So we're going to have a look at demand, rota and roster in a moment, so you can see how all this is built up. So you will be able to assign people to do shifts, and you can mark them as being what we call approved. So you can lock your roster down, but not let your staff know about it until you're happy that you've got all of your shifts rostered. You've got ideally nobody as far as agency workers within your roster, and you might not want people on 0 hours contract because you want to fulfill your contracted hours. So you will be able to look at this view based on contracted hours as well. You'll also be able to just filter and say, well, how many shifts have I got unrostered? So I can see that I've got some day shifts, some night shifts in my team, and here I need a night care worker. If I drill into that particular one, or highlight that one, I could go in and assign, send it as a shift offer to one or many people within here, or I could drill into that particular one and have a look at everything that was happening on that day. But if I drill in, it would allow me to drill in, do a search, find out who's available. I can go down and have a look. Well, Emma's available. I'm going to allocate her. I can see how far she is as far as her target contract to maximum hours are concerned. It will change colors as it gets closer. Once they've met it, it will change red. If I can allocate her to that, now I no longer have an unrostered shift on that particular day. If I go back to my weekly roster and have a look at Emma, I'll then be able to see that Emma is now assigned to a particular shift that I've allocated. So let's go back to the main menu. And we're going to look at how did we get to live service delivery? How did we get to a weekly view? We got there by setting up demand, rota, and roster. So within demand, you can define for your team, your care home, your hospital, your other business, how many hours do you actually need of different job roles? So in the case of the care home here that I've got multiple job roles. I can then see how many hours I need of each job role within a specific location of a service that I am providing. So again, if this was a hospital, this might have your different bands in different wards. If it was a kitchen environment, it might have things like chefs and so on. If we wanted to look at this on a different day, then I might have different information on, say, the previous day. So yesterday, I didn't need an activities coordinator. Today, I do need an activities coordinator. So my hours are changing on a day-by-day basis, because some things might happen 7 days a week. Some things might only happen Monday through to Friday. There is also the target cost, because the cost is picked up based on what you have set your target to be for each job grade. Again, we can filter this information out. If we go down a little bit further, it's made up of your service, your job role, where they're going to be located within your team or your care home or your business environment, what the base hours are, and what the frequency is. So how often does it occur? 7 days a week, Monday to Friday, specific days, perhaps in the case of activities coordinators or even receptionists. they might only work Monday through to Friday. So you'll set up your recurrence as a base level. Now this can change, especially if you're working in something like a care home where you've got flexed occupancy. It might go up, it might go down. So these hours can be adjusted. They can also be set from a date to a date as well. So we start with our demand. That's what we're expecting. Ideally, that should not change. We then set up what shifts are required in this particular team to meet that actual demand. And again, we will have a dashboard at the top to show us what our demand hours are, how many hours we might have rotated, and we might have over-rotated. So we might have too many shifts to meet the demand. We might be less. So we can easily identify this information. So again, we've now got our demand hours here, our location and our services. And I'm going to just filter this for a moment. And I'm just going to have a look at my care manager to start. So if I just scroll down, the way that the system will work is you can define the demand that is required for a care manager in a specific location based on your 24-hour clock. So in this particular case, I have set from 9 o'clock all the way up to 4:30. I require just one care manager. So 1 hour covered during this time. And that 1 hour is covered by one long shift from 9 till 4:30 as a care manager on this particular day. But it will move forward and move forward and move forward. Now, if I change that and I have a look at something like, say, the receptionist, or I have a look at the activities coordinator, I can then see in this particular case, I've got activities from 9 through to 12, and then I've got my admin 9 through till 3, and those are the shifts. I just need one shift on those particular days of those services. Let's have a look now at, let's just take those off. It'll give me a little warning. I have to have something. Let's look at care workers. If we have a look at care workers, we could also incorporate senior care workers, or we might have registered nurses. Now we've got a different view, because what's now happened is I've got two shifts in this particular case of care workers. So I've got a 7 till 12. I've also got a 11:30 till 11. I've got a night shift, so I've got a 1 and 1. But I've got a variance here. So somewhere my actual shifts do not meet my actual demand. So it will either go blue if it's over, or it will go orange if it's under. If we took one of those off, so let's just take the senior care worker off, you can now see that I've got a variance here at 10 o'clock at night. So your number of hours might be different at nighttime to daytime. And if it does not meet when you set this up, so this is like a template. This is what should happen based on your demand. You would normally expect to have two shifts, one shift, one shift. If you were a much larger care home or a much larger team like a hospital, then of course you may have a lot more shifts that you need to cover. So if we just scroll down a little bit further in this particular case, I'll just look at it for care workers to start with. So I'll filter that for care workers and scroll down. You can see now I need 6 shifts in the morning, 6 shifts in the afternoon, 2 at night. But again, what I've done is I've said I only need 2 at this particular time. So in this case, it's shown you as a plus. So the live inbuilt dashboards allow you to monitor exactly what your demand hours are, how many hours you might have rotated. It will also give you your estimated cost as well. You can break it down into your different job roles, even your locations and the services you provide. Now, on services provided, it could be that you do have things like care managers or care staff who are also doing things like one-to-one. So you might have a lot more services linking in to a specific job role. Let's go back to our actual care home once more. And I'm now going to skip across to roster. So roster is all about what is actually happening as far as the staff that can do the actual work. So as far as the staff that can do the work, we want to be able to allocate who can do what particular roles at what time. So down here, we now have our actual demand. We have our shifts, so we can see our variations. I've got everything selected for the moment. And over on the right-hand side, we've got our status count. How many shifts are in progress? How many have been published? Have we got anything that has been planned but not sent out? Anything that's actually been completed? If we just scroll down a little bit further, we can then have a look. Let's open up our residential support workers. We can now see that we actually have our 2 shifts that we require. We've got myself who finished their shift, but Zoe who hasn't yet finished their shift on here. So if we needed somebody else to do a shift, we can come in here on a day-by-day basis and allocate, or we can do things like shift offer as well. However, you might have things like rolling rotas. So you might want to say, I want the system to automatically allocate this for me. I don't want to have to go into a specific week. So for example, let's say that I want to go into next year and I want to have a look at the 4th of January. If I go into the 4th of January, on that particular day, what it's going to do is it's going to show me what my demand hours are. It's going to show me what my rostered hours are. And it will also show me my target cost and my planned cost for all of my job roles in my various locations. If I go down a little bit further, you can actually see that I've already planned somebody. So maybe Donna always does this particular shift on here. So she could be preset to always do that particular role. She's a care manager. She always does 9 till 4:30. If we just have a look at this shift, it might be Zoe always does this particular shift, but we never know who's going to do the other one. So we can go in and do a search and find somebody to do that particular shift within here. If I just go back and say that I did want to look for somebody else, again, it will check and have a look. So if I just open this up a little bit further, if I wanted to have a look for somebody else to do the assistant manager's job, then what I could do is go in here, do a particular search. Again, it's looking at my target cost. It's come up with Sky Cooper. I can check he's got the skills that match. There's nothing essential in this particular case, so that's great. And there's his target hours, there's his contract, and there's his maximum. So you can come in on a day-by-day basis and you can allocate staff. What you'll also be able to do is to set up what we call work patterns within the system. So each person may not work a night, they might not work afternoons, they might work on what we call a 1 week, 2 week, 3 week rotation of shifts. So somebody might work an overnight shift, they might work an early, they might work a late, and that can change on a day-by-day basis. So what you'll be able to do is to set up the work pattern for each individual person. And when you set up the work pattern for each individual person, you can run something called auto roster. What the auto roster will then do is it will select the person based on their job grade, based on the service and any skills that are specific to that service. It will make sure they are available and it will make sure that they work within this particular work pattern. So an early can be completely different on different days. It might be an 8 till 2, it might be a 7 till 1. You will have your own sort of work patterns within here. So when we come to look at our roster, and let's say that we'll just go back, we'll go back to the main summary and let's have a look and see what's happening on the new year. If we go into the new year and have a look at our roster, then what our roster will do is show us anybody that works regular shift patterns. So I just need to skip across slightly. So what I will be able to do is to have a look in here, and as I move across, I can actually see anybody that's already been allocated to shifts. So automatically, it may have allocated Donna to do her registered manager's role. You can see that it's done Bill to do a senior day shift. It's done Alan to do an early care worker shift. It's in this color because it's been approved but hasn't yet been published. So once you're happy to let people know what they're doing, you'll be able to go in here and say, approve this roster. Now, ideally, we would like to see this field a lot better. We would not want to see lots and lots of unrostered shifts, but if we do, we'll also be able to see them on a week view and drag and drop or assign within here. Now, I'm conscious that the actual time is going, so anybody that would like to see a little bit further or want to book a full demonstration, then please send us an email at healthandcare@civica.co.uk or contact your account manager and they will arrange a full demonstration for you, so we can then talk specifically about your actual requirements. Now, I can't actually see anything in the chat, but if anybody does have anything that they want to talk to me about further, and I know we've got a real mix of attendees here, so please just send me an email or send an email to any of the actual email addresses as above. So I'm going to say thank you for your time today. And I'm sure that everybody has lots of different meetings and visits today. So thank everybody, and I'm going to end the meeting for today. Thank you.